The newborn period core review. A newborn assessment should begin with a prenatal history. The prenatal history should consist of a review of the pregnancy, past pregnancies, and the mother and father's medical and genetic histories. The perinatal history should include a record of events surrounding labor and the APGAR score recorded at 1 minute and 5 minutes after birth. Postnatal history should include any problems such as bleeding, anesthetic reactions, breastfeeding complications, and maternal depression. Let's get into the newborn exam. The average length of a newborn is 51 centimeters. The average weight is 3.6 kilograms for males and 3.5 kilograms for females. The average head circumference is 35 centimeters. Term newborns are between 37 and 41 weeks gestation, and the Ballard score should be done within 12 hours of birth. A low score shows immaturity, and a high score shows maturity or post-maturity. Newborns whose weight is within the 10th and the 90th percentiles for their gestational age are considered appropriate for gestational age. And then large for gestational age is greater than the 90th percentile, with causes including maternal diabetes, maternal obesity, and genetic syndromes like Beckwith-Wiedemann syndrome. Complications from this include hypoglycemia, birth trauma, and transient tachypnea of the newborn. Small for gestational age is less than the 10th percentile, and causes include maternal smoking, substance use, placental insufficiency, and infections. Complications from this include hypoglycemia, hypothermia, and polycythemia. Vital signs in the newborn: temperature between 97 and 98.6 degrees Fahrenheit. Heart rate is 120 to 160 beats per minute. Respirations between 30 and 60, and blood pressure is less than 112/74. I'm going to go over some skin conditions. Often begins as flat, evenly pigmented patches, but later may become uneven and speckled. There's a small risk that this may develop into melanoma. This is congenital nevi. The port wine stain versus the salmon patch, or nevus planus versus nevus simplex. So with the port wine stain, think flames. So when the chefs are cooking in the kitchen, they use wine to make these big flames, and then wine stains are permanent. The port wine stain starts out pink, and then it gets darker red and goes into purple, and it does not blanch. It has well-defined borders, and they're usually unilateral. A port wine stain can be found on the face, occiput, and neck. It's permanent, and it may be associated with Sturge-Weber syndrome if located on the forehead or eyelids. And consult neuro and ophthalmology. Nevus simplex, or salmon patch, or stark bite, is blanchable, has irregular borders. When it's located on the face, eyelids, or glabella, it's called a salmon patch. When it's located on the nape of the neck, it's called a stork bite. It fades in about 1 to 2 years. It may persist at the nape of the neck, and it's benign. No workup is needed. This skin condition appears within the first weeks to months of life. It grows rapidly from 6 to 9 months. Most involute and disappear by age 5, and for those, there's no need to refer them out if they're small and uncomplicated. There are some high-risk ones that are large, segmental, or visceral. Immediately refer those out. They'll need further evaluation for organ involvement and possible syndromic associations. Those are hemangiomas. White papules, frequently found on the nose and cheeks, usually disappear within 3 to 4 weeks. Milia. White papules on an erythematous base, common on the face and the trunk. Resolves in 2 weeks. Erythema toxicum. Blue-black macules with indefinite borders, usually located on the buttocks and then usually disappears within the first year of life. These macules need to be documented to distinguish them from abuse. Mongolian spots. Thin-walled vesicles on non-erythematous, non-pigmented base caused by blocked sweat glands. They usually resolve when removed from the warm, humid environment. Miliaria. Light brown macules with well-defined borders greater than or equal to 6 spots may indicate neurofibromatosis type 1. Cafe au lait spots. Let's talk about the neurologic exam of the newborn. Cranial nerve 1, olfactory, is rarely assessed. Cranial nerve 2 can be assessed when the newborn turns toward bright light. Cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens, can be assessed when the baby gazes in all directions or there's spontaneous eye movement. Cranial nerve 5, trigeminal, the baby will respond to tactile stimuli. Cranial nerve 7, facial, the baby will show symmetric eyelid closure when crying. Cranial nerve 8, vestibulocochlear, the baby will become startled or blink to sudden loud noise. Cranial nerve 9 and 10, glossopharyngeal and vagus, the newborn will exhibit adequate sucking or swallowing. Cranial nerve 12, hypoglossal, the tongue will rest midline. There will be no deviations, which would indicate impairment. Let's talk about reflexes when they appear and when they disappear. So for the palmar grasp, it appears at birth and it disappears in 2 to 3 months. The plantar grasp appears at birth, and think of it like a plant, it stays a while, 10 to 12 months. Moro appears at birth and disappears in 4 to 6 months. Stepping appears at birth and disappears in 3 to 4 months. Tonic neck reflex appears at birth and disappears in 4 to 6 months. Rooting appears at birth and disappears in 3 to 4 months, except during sleep, and it could last up to 12 months. Okay, let's go to head and neck. Microcephaly is a head circumference less than 2 standard deviations. Macrocephaly is head circumference greater than 2 standard deviations. Frontal bossing indicates skeletal or hormonal disorders. Fontanelles that are wide indicate intrauterine growth restriction, hydrocephalus, Down syndrome, hypothyroidism. Let's distinguish between caput succedaneum and cephalohematoma. Caput succedaneum crosses the midline and resolves in days. Cephalohematoma does not cross the midline, subperiosteal, and it is slower to resolve. The newborn's hair should be uniform. If there's any white forelocks, that can indicate deafness, facial palsy, or droop, typically resolves within a few weeks, and asymmetric crying faces may be associated with cardiac anomaly. Epicanthal folds suggest Down syndrome. Blue sclera suggests osteogenesis imperfecta. Red reflex, the absence of it, is an urgent referral. Assess for ear tags, pits, webbed neck, which may indicate Turner syndrome, and then assess the clavicle for swelling and tenderness, which may indicate a fracture. The chest is about 2 centimeters smaller than the head circumference, and pectus excavatum, think cave, is sunken, and carinatum is protruding. These are structural chest anomalies. Cardiovascular sounds, you should have a regular rate and rhythm. S1 and S2 should be heard. Document any murmurs. Gallops need to be sent for further evaluation. Femoral pulses should be documented. If the pulses are diminished, that can be indicative of coarctation of the aorta. And then you need to check blood pressures in the upper and lower extremities. Ejection clicks, which also require further evaluation, may indicate pulmonary or aortic valve stenosis or a bicuspid aortic valve. Abdominal assessment should reveal an umbilical cord with 2 arteries and 1 vein, and it should be bluish white in color. Umbilical hernias may be present. They're usually benign and resolve spontaneously. When the abdomen is palpated, there should be no organomegaly and no masses. Bowel sounds should be present within the first few hours of life. The newborn should be inspected to identify the gender. Female newborns should have their labia minora and labia majora examined. Clear and white vaginal discharge and pseudomenstruation may occur within the first few days of life. An imperforate hymen should be referred out to a pediatric gynecologist. Phimosis is normal. The degree of hypospadias should be documented. Palpate the scrotum for testes. Blue testes, sign of testicular torsion. Undescended testes are not a cause of concern right now, but the testes should have descended by 6 months of age. Check to make sure that the anus is patent. Musculoskeletal, the spine should be straight and flexible with no visible defects or masses. Observe for sacral dimpling larger than 0.5 centimeters or located more than 2.5 centimeters from the anal verge. The lower back should also be examined for tufts of hair or skin tags, which may indicate spina bifida. The hands and feet should be inspected for syndactyly and polydactyly. Newborns should also be examined for palmar creases because a single palmar crease may suggest trisomy 21. Newborns with clubfoot or developmental dysplasia of the hips need to be referred out to orthopedics. Each state has its own mandated screening program, but every state checks for PKU, galactosemia, sickle cell disease, and congenital hypothyroidism. Now, these tests need to be done after the newborn is 24 hours old. If not, a repeat test will have to be conducted. Also, if the test is positive, then a confirmatory test needs to be confirmed. And prior to the newborn leaving the hospital, hearing loss and critical congenital heart defects need to be screened. Now, let's go into some practice questions. At a 2-month well-child visit, a mother loves how her baby grasps her finger when placed in his hand. What should you tell her? A. This is the palmar grasp reflex. Also a nice moment to acknowledge bonding with her baby. B. This is a voluntary action that shows your baby has strong fine motor skills and can control finger movements at birth. C. This reflex is called the rooting reflex, which helps the baby turn toward the mother's fingers for comfort. D. This grasp is abnormal after birth and should prompt a neurologic exam for hypotonia. The answer is A. This is the palmar grasp reflex, a normal primitive reflex present at birth that usually fades in 2 to 3 months. This is also a sweet opportunity to acknowledge the bonding between the parent and a baby. At a well-child visit, a father asks about his baby's birthmarks. The macules are light brown with well-defined borders. There are 2 spots. What should you tell him? A. These are Mongolian spots. They're normal and usually fade by the first year of life. B. These are port wine stains, which usually require urgent referral. C. These are cafe au lait spots. They're usually harmless, but we'll monitor the number and the size. If 6 or more appear or other findings develop, we will refer for further evaluation. D. These are hemangiomas. They may grow over the first few months, but in most cases, they are not a concern for your child. The answer is C. A term infant is brought to the nursery after birth. Vital signs are 98.6 degrees Fahrenheit, heart rate 147, respiration 40. On exam, you notice a firm, raised area on the scalp that does not cross the midline. What is your assessment of the exam? A. Cephalohematoma. B. Caput succedaneum. C. Cranial fracture. D. Infected scalp hematoma. The answer is cephalohematoma. This firm scalp swelling that does not cross suture lines is a cephalohematoma. It's usually benign, non-tender, and resolves over weeks to months. Now, caput succedaneum, it crosses suture lines and it resolves in days. And fractures or infection, it's pretty uncommon in healthy term newborns with, normal vitals. This wraps up the newborn cord review. Be sure to check out other videos on this page for more high yield content that actually sticks.